What questions do you ask on a job interview with a DSO, with a private practice, with a small practice, a medium-sized practice, large practice? I'm here with Colleen Bixler, University Relations Manager for Smile Brands. Colleen, so glad to have you joining us. Before we dig into our topic, just orient the Nacho audience as to who you are and what you do on a daily basis.
Thanks, Dr. Goodman, for having me. I appreciate it. I'm the University Relations Manager. So I run a team of people, and we do a lot of events, at universities, dental schools and hygiene schools and dental assisting schools. And really, our goal is to help guide people and teach people the right questions to ask as they're, going through the interview process. As you know, looking for a job is a lot like dating. It's about, finding the right fit for you. And a lot of people in dental school, you're not taught, how to ask the right questions or how to find what it is that you're looking for. We've all, been out there in the dating world, or most of us have, and, you learn what kind of questions you ask, during the dating process. So it really shouldn't be any different, for you looking for a job.
And I say this, Connie, I like that example, but I also, the dating process, if you, hey, Dua, how's it going? I'm just going to put you back for 1 second here. Cool. The dating process, I always say to my residents, you can be single and go home and watch Netflix on your couch and relax. That sounds awesome. But if you don't have a job, Colleen, you can't afford that couch, right? So it's even more serious than dating, right? You're single, relax, watch TV. So help us, for a minute, tell us about Smile Brands. How many offices do you have? Where are they in general? How many associates do you have working for you? Just tell our audience a little bit about that.
So Smile Brands is the 4th largest DSO in the country. We have over 700 dental practices across 29 states and about 200 affiliated partnered offices as well. So that brings us close to about 900 practices that we have relationships with. Wow. Across 29 states, going from Texas, Florida, all over the Northeast, and then sweep across the Midwest, all the way up and down the West Coast. So we're a substantially large, organization, and really want to offer a lot to the teams that join us. And currently, we have about 1,200 practitioners, 1,200 doctors.
1,200 dentists. I think of 1,200 restaurant chefs. They don't show up to work. People can't eat, and that is dentistry. So you're in charge of making sure these dentist chefs are inside of these restaurants. That's part of what you do?
Yeah, we take care of the administrative and a lot of the operations side, and really allow our practitioners to focus on what we feel is most important, which is patient care. That's what we have to give to our communities, is the care that we give to our patients. And first and foremost, that's most important.
Love that. So let's play. We're going to spend 10 minutes. I'm going to be the role of somebody looking to find a job. I could be a dental student. I could be a resident. I could be a few years out of school. You have put work into what questions to ask, what to look for. So what should I be looking for when I'm going out on these job interviews, Colleen? Give me a few value-based tips.
Well, the first thing I would ask you is, what are you looking for in a dental practice? What's most important to you?
Great question. What's most important to me is to be at a place where I'm not alone on an island all the time. I just graduated dental school. I don't know if you've heard of this thing called the pandemic, Colleen, but the pandemic has made it tougher to get as many clinical reps. So I'm motivated, I'm enthusiastic. I would like to make a medium amount of money. I don't have to make $300,000 a year, but I have dental school loans and have to pay rent. So I'd like to find a job maybe where I can make $140,000 a year and feel supported.
Fantastic. And we have lots of those opportunities that are available to you. Now, one of the things I want to ask is, are you looking to have somebody, in the practice with you? Are you looking to have mentorship maybe from outside, somebody that you can just pick up the phone and call? That availability of, that type of mentorship, if it's something that's customizable to you, if that's something that's important to you. Those are some questions, that I would certainly ask.
Great question. I'll kind of play the role of now, Dr. Nacho. I say on every job interview, whether you've been a dentist for 1 year, 20 years, how often am I going to be the only dentist in the practice? And just so you have awareness of all the responsibilities as that only dentist, I would share with you as a new grad, Colleen, it would be great if I could spend face-to-face time with another dentist for at least half of my week. So I would love to be in one of your locations where there's another dentist who I can ask questions to. If something's not going well in my operatory, I could say, hey, check this out. That would be important to me.
Fantastic. Is there anything else that's important to you as far as work-life balance? Where do you want to grow, as a practitioner? Are there any areas that you're interested in?
I would say that I like dentisting, as I call it, full contact arts and crafts on people that don't want to be there, but I'm not a 6-day-a-week type person. I think there's a lot of energy seeing patients all the time. So I would like to look for a schedule that's 4 days a week. And as a new dentist, I don't mind working a few Saturdays.
And that's fantastic to know that, because, those are all things that, we like to document and see what it is, that you're willing to work. That's one of the biggest advantages of working for a larger organization is you do have that work-life balance, because a lot of the administrative duties are taken off of your plate. You don't have to pay the electric bill. You don't have to pay the water bill. The average dentist spends private practice owner spends anywhere from 10 to 25 hours per week in doing just administrative duties. So if you're looking to have that taken off of your plate, then, a DSO might be the right opportunity for you. When you're looking at private practices or an institution, things that you might want to explore or see what it is that is being offered to you is, are there specialists in the practice? And if there are, does that limit your professional capabilities?
I'll interject. That's a great question, because we have specialists in our practice, and it does give our associates the opportunity to learn, but they don't get the opportunity to do as much. So you have to fit, is that the right fit for you? I think that's a really golden nacho tip that you gave, Colleen. Ask, are there specialists coming to the practice without judgment, but just for awareness? Hey, maybe you don't like doing extractions and you're thrilled to have someone come in and do that, but you also might be limited. Colleen, I want to ask this question. Let's say I had the courage to say, you know what, Colleen, I went to dental school, DSOs came and did lunch and learns. Are DSOs going to make me push treatment on my patients? Am I going to have to get them to do 5 quadrants of scaling and root planing? Because I've heard that about DSOs. Tell me a little bit about that mindset, not just for Smile Brands, but across the board.
I was doing a lunch and learn at Case Western University, and I usually pose the question of, what have you heard about working for a DSO? And I had one of the most shocking answers that I'd ever received. And it gets me a little choked up because it was so emotional. They said, I'm afraid I'm going to have to sell my soul. And I was like, what? Are you kidding? No, wait a second. What do you mean by that? And they were worried about work-life balance. They were worried about the treatment planning and, all of that. And those are very, very valid questions and concerns. When you're going and interviewing, whether it be in a private practice or in a group practice, asking the question of, if I treatment plan a patient, is that my patient? That treatment plan is mine. No one's going to come along and change the treatment plan behind me, present a treatment plan that I didn't put together myself, or cherry pick my cases. I've heard story after story of, people going into both private practice and group practice where they treatment planned a patient for crowns on the upper anteriors. And then 3 years later, after talking with this patient, they walk in the door and Dr. Bob has the patient in the chair and they're getting all their crown preps done. And they're like, whoa, wait a second. And I've, heard stories of, dental directors or people come along and presenting treatment plans. And the question to ask is, if I treatment plan a patient, is that my treatment plan? Am I the one to present this treatment plan?
I want to pause you or interject. That's such a great question to ask. And as somebody who has multiple associates, this is a bigger picture. So first say, if I treatment plan everything, do I get to do everything? First, I say, can you do everything? Because, maybe sometimes some of the care should be referred, let's say it's a retreat of a second molar root canal. So I think it's important to define what you're comfortable with, confident with, and then what you want to grow into. In your organization, Holly, let's say a young dentist like me, old me, not existing me, or previous me, says, I also would like to learn some new skills. Is there any opportunities for CE or to observe other dentists? How is that a good question to ask on an interview, how you can actually develop your skills?
100%. And I recommend it. In fact, I tell people take advantage of us when it comes to continuing education. That is one of the biggest assets of working for a larger group, is that they usually do offer some phenomenal continuing education. And that should absolutely be in the repertoire of questions asked, during the interview process. I know that my organization puts out a list every month of all of the CE that is available, as well as what's available on demand. So you can put on your ducky shorts, come home from work, grab a bowl of, dinner and, enjoy it and sit there and watch some CE. So, making sure that that organization or, your company or, the practice that you're working with, if they offer continuing education, see if you can get an idea of what it is that they're offering and make sure it's in alignment with what it is that you're pursuing, whether it be with, single unit implants, molar endo, because most dental students, don't feel comfortable doing molar endo. Now, again, most organizations have specialists and they're specialists for a reason. Most organizations don't expect you to do complete bony impacted third molars or,
I wanted to share that this is just valuable for anyone listening at the time. I'm talking with Colleen Bixler of Smile Brands, in charge of managing and getting dentists into their 900 offices. Being asked to do too little is a problem, and being asked to do too much is a problem. It's a little bit of that Goldilocks thing. What is just right as you grow? Because sometimes I get messages from across the Nachoverse of, young dentists being asked to do too much. And I said, that's unfair. Doing bony impactions isn't fair to the patients. And then I have other ones saying I only get to do hygiene. So I think it's really key. Ask what C is available, as you suggested. Before we wrap up, Clint, I want to ask you about this. And our dentists love details. Without naming names, you weren't going anyway. What do people say on interviews that could potentially be a turnoff to you? They might not even realize it. That, what are some things to be cautious about that where you are interviewing someone and you say, I don't know if this is the right fit for us? Anything that you don't do or keep to yourselves? Anything that you can think of there?
Well, I know that, most dental students are coming out of school, with debt and they're concerned about that and their earning potential. As a dental assistant, someone who's been in dentistry for 27 years, if the first question out of your mouth is about compensation and the compensation plan, or how much money they're going to make, usually indicates to me that their first concern isn't caring for the patients, or their professional growth to be able to care for the patients. I always recommend, usually during the interview process, it's okay to be wearing scrubs, but, dress professionally if you, at least show that you're interested in having, good questions to ask, and, just be able to communicate effectively. Because quite honestly, during the interview process, we're picturing in our minds, can I see this patient, see this person relating to the patients, I'm looking for a dentist for my dental practice. And so if I'm going to be your patient, do I think you can, explain things to me in a manner that is effective? Dentistry is one of those weird professions. If you needed a heart transplant, you kind of don't really care, what the personality is of the doctor doing the heart transplant. You just want the best of the best, and that's all there is to it. But in dentistry, you have to not only be educational and explain to the patients why they need the treatment done. And it's not just because you have a boat payment or a Porsche payment or something like that. You have to be likable. And then you also have the skill set too. So dentistry is a unique profession.
I love that. Likability is so key. And you hit on a few great things there, from how you present yourselves. Scrubs could look great. Scrubs could look not so great. How you present yourself on the interview, and don't ask about money right off the bat. It's important to find out along the interview how compensation works, but show most interest, I say, into what procedures you're going to be doing. Why do they need an associate? Expectations before you get into that. Well, you've shared so much awesome value here, Colleen. I want you to just tell the Nacho audience, if they have a question about how to find a job, what to ask on an interview, learn more about what you do, how can they reach out to you?
The best way to reach out to me, you can text me or call me at 717-847-9069, or you can shoot me an email at cbixler@midwest-dental.com or Colleen.bixler@smilebrands.com. So either way, you can always
Awesome, Colleen. And people can reach out to us at dentistjobconnect.com. We're connecting associates in all states to share in the joy of full contact arts and crafts on people that don't want to be there. That's dentisting, Colleen. So we're connecting people across all these states. Just reach out to us at dentistjobconnect.com. Thanks so much, Colleen.
Thank you.